Hi, it's Dr. P here, and I just saw a patient who's a little over a year out from bone marrow cells and PRP injection into a calcific rotator cuff tendonitis, tendinosis, basically partial tearing that had a big calcium deposit in it. And she didn't want to do an actual testimonial and be on camera, which is fine, but she's doing 95% better. And once again, I wanted to show how the programs that we offer can not only offer subjective improvement, and she reached all of her goals, but also objective improvement, and I can go over the x-rays at least myself. Okay, so this is the pre-procedure x-ray of the shoulder joint, and there's the ball in a socket. This is the actual shoulder joint, and then there's a calcium deposit right here. The rotator cuff comes over and attaches here, and that calcium deposit was there just before we did the injection a year ago. Here are today's x-rays, and that calcium deposit is completely gone. Her symptoms are resolved, and she has reached all of her goals. And her goals were to have no pain in the shoulder, dress without pain, sleep without pain, and be able to do everyday daily activities without pain, which she is able to do now.